Now, pain is modulated by many factors. So let's have a bit of a quiz and see which ones you can get right. If the patient's anxious, what's that going to do to the amount of pain they're likely to experience? Well, if a patient's anxious, it's going to increase their sensitivity to pain. So if you walk around in your white coat with your stethoscope strung around your neck and your patient's terrified of you because you're in control and you're going to do something horrible to them, you'll increase your patient's anxiety. You will have been responsible for increasing your patient's level of pain. You must seek to reduce your patient's anxiety by coming alongside them, by empathizing with them. Anxiety will increase pain, as will expectation. So if you say to your patient, well, I've got this piece of steel here, I'm just going for a cup of tea now, but when I come back I'm going to stick it into you, they'll be anticipating that, they'll be expecting that, and that can make their pain worse. So anything we can do to reduce expectation of pain is good. And there's actually descending pathways which increase the sensitivity of pain transmissions through the spinal cord, but they can be stimulated by anxiety and expectation. Descending activating pathways can be hyperalgesic or analgesic. Now, what about the placebo effect? Is that going to increase pain or reduce pain? Well, the placebo effect is one of the most interesting psychological effects I've ever come across. And basically what the placebo effect is whatever the patient believes is going to happen to them that's good will happen to them. So if I say to the patient, well, I'm going to give you a very quick, not very painful injection here, but it's a proper injection. I'm very good at giving injections. I know exactly the right drug to give you. This drug is going to benefit you really, really well. And if the patient believes in me, if the patient believes me, the fact that they believe that will reduce their pain. And we know this because clinical trials have been done on this, giving patients injections of salty water. We know that giving a patient 2 pills for pain in a day is better than giving them 1 pill for pain for a day. We know that big red pills can have a greater analgesic effect than small white pills because the patient believes it's going to work. Now, we must never lie to our patients. We must never say, I'm giving you an active treatment when we're not giving them an active treatment. That would be lying, that would be completely unethical. But if I am giving my patient an analgesic and they believe it's going to work, that enhances the effect. So that's great because the patient gets the analgesic effect, the pharmacological effect, but they also get the placebo effect as well. And we could well be talking about an additional 30% of analgesic effect. So if the patient doesn't believe the injection is going to work, the analgesic effect might be 70%. If they do believe it's going to work, I'm going to get that extra 30% because the patient believes in it. Now, it is interesting to mention there's the converse of that is the nocebo effect. And with the nocebo effect, if the patient believes they're going to get sick, they probably are going to get sick. This is probably how witch doctors keep in business. They put a curse on someone, and if someone believes that, they get a nocebo effect. And it can be a real effect. But we're not interested in nocebo effects because that does harm. We are interested in placebo effects because that can benefit our patients. Now, what about emotional arousal? What can emotional arousal do to pain? Well, if someone's excited or ready to get up and go and do something, then that can reduce the amount of pain they experience. As can the need to take effective action. If people need to take action, the analgesic system will kick in to allow them to take effective action. Now, what about if someone is concentrating hard on something else? This is called attentional modulation. So if the patient's doing a crossword or engrossed in a TV program or listening to music or playing chess, if the patient if their mind is engaged in something else, what's that going to do to the pain? Is it going to increase the pain or is it going to reduce the pain? Well, again, studies have shown that this can reduce pain. So giving our patients some distraction, music, watching TV, talking to a relative, whatever it is, if that can distract them, that can reduce the pain. It's called attentional modulation of pain. Circumstances can reduce pain as well. Usually if the patient has to take some action, the immediate environment, cultural factors, all these things can influence the way people express the pain anyway. But always remember, all human beings from whatever race, from whatever culture, are identical. We're all very, very closely related. So what hurts me is going to hurt someone from another race or another culture as well. Sometimes the need for changing body position can be helpful. This can relieve the pain physically, like if you've got a sore back and you move it, you might feel better. But sometimes just the ability to move around can make the patient feel a bit better. And humans seem to have a need to let others know they are in pain. This seems to reduce pain. So if patients are in pain, the mere fact that you let them know that you have taken that on board, that you know they are in pain, can sometimes help to reduce the patient's pain. So quite a few things can modulate the individual's response to pain, and some of these we can take advantage of to help to reduce the amount of pain our patient is suffering from.